Universal health care in the state of New York is actually more possible than you might think, and it all has to do with the New York Health Act. The New York Health Act has never actually been passed, but people have been trying to get it passed since 1992. And it actually has been passed by the Assembly 5 times, but never by the Senate, so it cannot go into law. Okay, but what does it actually do? I'm going to start off with the simple explanation first, and then we can add complexity. If the New York State Health Act were to ever pass, health insurance companies no longer can exist in New York. There's no such thing as health insurance in New York. However, you keep paying your premiums. You pay that dollar amount, but instead of going to Blue Cross or Aetna or Independent Health, it goes to New York State. And what do you get for it? What you get for it is all health care in New York is just free. You just go. It's all in network. You go to CVS, pick up your prescriptions, it's free. Go to a dentist, get your teeth cleaned, it's free. Cancer treatment, hip surgeries, nursing homes, it's all just free. So how do the doctors and all the medical facilities get paid? They turn around to the state and they say, this is how much work we did, reimburse us. And the reimbursements come out of that big pool of money that now exists because people are not paying their premiums to the health insurance companies, they're paying their premium to the New York State Department of Health. Well, how do you pay for it? How do you pay for that? Motherfucker, where you're not listening. You are already paying for it, right? If you give $300 every month to Blue Cross Blue Shield, and then you stop and you start giving $300 every month to this great state of New York, you're not giving away $600 every month. There's a couple different advantages to doing it this way. It puts all medical providers into one network for everybody in New York State, which means there's less bureaucracy for you, the patient, to have to deal with. The health insurance company is a needless middleman that needs to jack up the price to make profit. You're cutting them out of the equation entirely, which makes the whole system more efficient. It makes your health care no longer tied to your employment, so if you want to start your own business or go job hunting, you don't have to worry about losing your insurance. It puts New York State in the position of negotiating for lower prices with the healthcare providers, which is a pretty powerful entity to have to deal with. Like if you were to call up Pfizer and say, I think this Lipitor costs too much, I think you could come down in price, good fucking luck with that. But if New York State were to call up Pfizer and say,
I think this Lipitor costs too much,
they might have a bit more success than you. And remember, this act is just creating a new payment system. Private companies and nonprofits continue to actually run the hospital. None of that changes. Now, there's obviously an awful lot of details to work out. Like, what are we going to use for a definition of a New York State resident? What are we going to do about people who split their time between New York and other states? Those are real concerns that are worth thinking about, but there's also concerns that people bring up that aren't really concerns about the New York State Health Act, they're just concerns about healthcare in general. Like somebody might say, well, what's to stop some crooked doctor from saying all of his patients need knee surgery as a scam to milk money from the state? Okay, sure, but also, what's to stop a crooked doctor from saying all of his patients need knee surgery as a way of milking money from the health insurance company? It's not a problem for the New York State Health Act, it's a problem for the New York State Department of Health, and you have to deal with it no matter what system we have for paying for healthcare. Anyway, since this idea has been kicking around for 30 years, it's actually pretty well studied. There was a paper done by the Rand Corporation in 2018 about it. UMass Economics Department did a paper about it in 2015. And there's some real organizations that are in support of it, like the New York State Senior Action Council. New York State Nurses Association is a big supporter of it too. Okay, if you're in New York and you think this is something that you'd like to see passed, what can you do? The number one thing is just to know about it. Like 95% of New Yorkers don't know about it. Get on the Google machine, find these reports and papers and old news articles, learn about it. Talk about it with your friends, talk about it with your coworkers. Post content about it on social media and tag the shit out of anybody who's a big creator that lives in New York. Tell people, spread the word. That's it. Do that, and this might actually be a thing that happens.